Okay, so as I was saying before we got cut off, you plant 0.1 ml of the PPD, and then you read it at 2 different intervals, 48 hours after implantation, and again at 72 hours after implantation. It is the induration again, not the redness. So who are considered positive? There are 3 groups of people who are considered positive. 5, 10, and 15. What are they again? 5, 10, and 15. Who are positive at 5? Now, a reaction of 5 or more is positive in these patients here. HIV positive or are immunocompromised. So again, who? HIV positive, AIDS patients, or patients who have immunosuppression. So those people taking steroids, cancer patients, etc. Okay, so if they have low immunity, they have a 5 millimeter or more induration, they're positive for TB. Now, it's 10 if they are like you and me, healthcare workers, those IV drug users, the ones listed here. Okay, except for this one. This group here are when are they positive?
5.
5. So everybody else who are in this chart, if we are in this chart, other than this group here is 5. Everyone else on this chart, IV drug users, people living with people who are positive, immigrants, into institutionalized patients, or those who are healthcare workers, we are positive if the induration is 10. Are we clear? Right? We're positive if we are 10. We need the 10 or more to be positive. Everybody else who's not listed here, who do not belong in chart 19-10, have to be 15 in duration in order to be positive. Okay, so let's go to CDC. If you search this CDC PPD interpretation, look for this fact sheet right here. And it will tell you the same thing I just said. So here are the 3 people who are positive. So 5, 10, and 15. So immunocompromised people, 5. 10 or more is positive in these people here, as I mentioned, including us who are healthcare workers, and everyone else who do not belong here, have to be 15. Any question?
No.
All right. So that's for PPD. Now, let's say you don't like the PPD, it's too painful. Your insurance covers quantiferon. All right, so you get the quantiferon. This one, if you're positive on quantiferon, then you're positive. Now, who gets quantiferon? Who is recommended to get the quantiferon instead of the PPD? Now, people who receive the BCG vaccine, like myself, because I was born in one of the countries mentioned earlier, the Caribbean, Asia, Southeast Asia, or Africa, Latin America, for instance. So we are all given the BCG vaccine, correct? So therefore, can it result in a false positive for the PPD? Yes, okay, because this is the organism, okay? So if we receive the BCG within 10 years, it will likely cause a false positive reaction. But not every time though. If it's been over 10 years since you've been vaccinated, obviously it's been over 10 years for me. If I turn positive for the PPD, I most likely have been exposed to TB already. Okay, because the BCG does not provide lifetime immunity. Are we clear? The BCG current evidence shows that the BCG vaccine does not provide lifetime immunity. It wanes over a few decades. So after 10 years or more, it does not protect you anymore from TB. Are we clear?
Yes.
All right. So if you have the BCG vaccine and most likely, it was in the last 10 years, for instance, then the doctor will recommend getting the quantiferon. Okay? Or let's say you have a positive reaction here for PPD and you want to confirm whether it's accurate or not because you have a history of BCG receiving the BCG vaccine, then they'll do the quantiferon. Because this test is not affected by a patient's previous receipt of the BCG vaccine. If it's positive here, it really is positive. The only, neither test, the PPD and the quantiferon, only does what? What does it prove?
If you are positive or negative, or
Okay, let's clarify it. These two tests, or even the T-spot test, none of them confirm that you have an infection. All they do is prove that you have been exposed to TB. Again, all these tests, the tuberculin tests, quantiferon, T-spot, all they do is show that you have been exposed to TB, meaning you have the TB bacillus inside you. However, it cannot prove whether or not your infection is active or inactive. Again, what do they do?
Prove that you were exposed.
Okay, none of them will prove that you have active or inactive TB. Remember, we have two types of TB. You have active, meaning you have symptoms, you are contagious, or you have latent TB, meaning you have no symptoms and therefore not contagious. So here, under PPD, it says clearly here, they cannot prove whether it's active or latent TB. Are we clear?
Yes.
And here, the same thing also under quantiferon. It cannot prove whether or not you have active or latent TB. So more testing will be needed. So if you are positive, then most likely what they'll do is get an X-ray. Same thing here. For PPD, if you're positive, then they'll send you for an X-ray. Unless, of course, you have symptoms. If you have symptoms, then we'll get a sputum sample from you because you have symptoms. And only the sputum culture will prove whether or not you have active TB or latent TB. Does that make sense?
Yes.
Okay, so here, a culture is done to confirm active TB. Let's go to manifestations. Okay, here are your signs and symptoms. So we've got low-grade fever. It's not high-grade. Why not high-grade fever? Why doesn't the TB infection cause a high-grade fever? Because what is the characteristic of the organism?
Hello.
Very slow growing. So it's not capable of causing an acute active infection. It can only produce a low-grade fever. Cough, night sweats, fatigue, weight loss. And these are not acute. Okay, so this is over a month. Okay, so at least a month or more of these symptoms. And then the sputum, of course, may be purulent. You know, there's pus in the sputum. Treatment. Of course, the prevention would be the vaccine, but here we are. We have an active infection. If you have latent TB, again, you have the option to refuse treatment because you're not infected. Therefore, you're not contagious. I mean, you're not symptomatic, sorry. Latent TB, you're infected. However, you don't have symptoms, so you're not contagious. So you don't have to have treatment. However, do you want to get treatment or not? You are infected.
Yes.
Yes, better to treat it. If you have latent TB, you will only take 2 medications, INH and rifampin. All right, INH and rifampin if you have latent TB. For how long? It's about 6 months. Okay, so 6 months of INH and rifampin, all oral. Now, if you have active TB, you will be taking 4 medications. INH, rifampin, pyrazinamide, and ethambutol. These 2 are the same as rifampin, so disregard these 2. So what are the 4 drugs for active TB?
Ionid, rifampin,
Rifampin.
Ethambutol.
and ethambutol.
Pyrazinamide.
So 4 drugs. Now, it's important to note that how is it used? Okay, so there are 2 phases in treatment. So again, latent TB, no problem. You just take these 2 medications for how long?
6 months.
6 months.
If you have latent inactive TB, no symptoms, not contagious, you take 2 drugs for 6 months. That's it. If you have active TB, you'll be taking 4 drugs, INH, Rifam, pyrazinamide, and ethambutol. There are 2 phases for the treatment. Initial treatment and continuation phase. The initial phase will be all 4. There will be a vitamin supplement added, B6, because here on the nursing consideration, isoniazid, INH, causes peripheral neuritis. So therefore, it depletes your vitamin B. So that's why you're taking vitamin D, vitamin B6 or B complex vitamin when you're on this drug. Okay, so that's why it's added here. That's why you see the vitamin B6 added here. Any question? Okay, so how long is the initial phase? The initial phase is 8 weeks. Initial phase is 8 weeks. How many drugs are involved? 4, all 4 plus the vitamin B. All are taken once a day, all PO. Okay, so that's for the first, how long is this? All 4 drugs plus the
8
vitamin
weeks.
8 weeks. So that's the initial. Now, the continuation phase, the continuation phase of the treatment is only 2 drugs, INH and rifampin. For how long? 4 to 7 months. So how long total? 6 to 7 months, right? Because you have 8 weeks, that's 2 months plus 4 or 7 months. The doctor will tell you whether you need 4 or 7 months of the continuation. It really depends on the strain because there are different strains of the TB. All right. Any question on the treatment? Now, why do we need to know the treatment? Well, who are these patients again? Who are going to have TB? Who are these people?
Most likely people that cannot afford health insurance.
Or who else? So we have immunocompromised, HIV patients, homeless people, correct? We have IV drug users, correct?
Migrant.
Correct.
Immigrant.
So therefore, are they likely to comply with the treatment?
No.
No.
It's very hard. Have you ever taken in your life, any of you here, have you ever taken something for 6 months or more?
No.
No.
Oh, so it's not gonna be easy. Look at we're just talking about the duration here. Let's look at the side effects of each drug. So how long are you taking INH and rifampin total for active TB?
6 months.
6 months, 6 to 7 months. Okay, look at the side effects. So for INH, so this is B6, by the way. Okay, so the pyridoxine is vitamin B6. Look at the side effects. Causes hepatic damage, right? Causes liver damage. So therefore, can you drink alcohol while on this drug?
No. No.
So here, no alcohol. Okay, for how long?
6
At least
months.
6 months.
6 to 7 months, no alcohol. Rifampin, same thing, causes hepatitis or damages your liver. So therefore, can you drink alcohol with this drug?
No.
No. So 2 drugs, no alcohol because they cause liver damage for whole 6 months. And then rifampin causes this as well. Although this is harmless, it does discolor your tears, your saliva, your urine will become orange while on this drug. This is not harmful though. Okay, just want to make sure. And what do you remember about evidence of liver damage? How do we know you have liver damage?
Yellow skin.
Yellow skin, what else?
Yellow eye.
Yellow eyes. What happens to your urine color?
It becomes darker.
It becomes darker. Okay, dark as in tea. Have you seen tea? The color of tea? Or Coca-Cola or Pepsi. Okay, so same color as that. It's dark. Is darkening of the urine the same as orange color? Is that the same?
No.
No.
No. Orange is bright, correct? This is
Yeah.
bright color. This is evidence of liver. The darkening of the urine is evidence of liver damage. Is this liver damage here?
No.
No, it's not. So this is harmless, okay? This is a harmless discoloration. Although it will damage your favorite underwear, it will stain it, permanently. It will also stain your contact lenses if you wear them. But this one is harmful, right? The darkening of the urine, yellowing of the skin. Are these harmful?
Yeah.
Yes, because they indicate liver damage. Are we clear? Any question about these? Are these the same as darkening of the urine?
No.
No, this one is okay. This is expected. Is this expected?
Yes.
Meaning this is expected?
No, it's not expected.
It's not expected.
Okay, but it can happen, correct?
Yes.
Yeah.
Yes.
This is a complication. This is expected. This is supposed to happen. This can happen, but do we tell the patient to expect it?
No.
No, you tell the patient to do what? When you see yellowing of the skin, the eyes, and darkening of the urine, what do you tell the patient to do?
To report it.
Call the doctor. This one, what do you tell the patient to do when you see these?
It's expected.
Yeah, just don't wear your favorite underwear, okay? Wear the worst underwear you can have, okay? Or don't wear your contact lenses, Okay, but this is, expect this to happen while you're taking this drug. Any questions so far? All right, so for how long do you take these two drugs again?
6 to 7 months.
6 to 7 months. Okay, let's go to the other two, pyrazinamide and ethambutol. How long are we taking these?
4 months.
8 weeks.
8 weeks.
8 weeks. Okay, so only during the initial phase. So initial phase is 8 weeks, 4 drugs. Clear? So 4 drugs during the initial phase. Right here, initial phase, INH, Refam, PZA, and ethambutol. Plus the pyridoxine for how long?
8 weeks.
8 weeks. For the next 4 to 7 weeks, how many drugs left?
2 drugs.
2.
2. What are they?
Iso.
And with pen.
INH and rifampin. All right, let's go to side effects. Pyrazinamide, you can also call this PZA. This is the side effects. Causes hyperuricemia, meaning causes gout. So because it causes gout, what do you always tell the patient? How do you prevent it? Drink how much? You should drink a lot of water. Okay, so increase fluids while you're on PZA to prevent hyperuricemia, so increase fluid intake. Also causes liver damage, so still no alcohol. Ethambutol is the last one. This causes optic neuritis, which can cause blindness. So what should you tell the patient to do?
Wear sunglasses.
Okay. No. It doesn't cause photophobia. Optic neuritis. So therefore, it causes optic nerve damage. So therefore, what should you tell the patient?
Get an eye exam more frequently.
Correct. Okay, so if any vision changes, what should they do?
Contact their provider.
Call the provider immediately. All right, any questions about these drugs? Very good, children. Okay, now if you look at it, so let's say you have TB and we are treating you for it. What are you going to do during the treatment? You have active TB, you have symptoms, you are contagious. So what are we going to do?
They isolated.
Isolate.
So I'm going to isolate you for 6 to 7 months.
Well, wear a mask for 4 to 6, 7 months.
No, that's what I'm asking. So do we isolate the patient? Do we put them in a negative pressure room for 6 to 7 months?
Yes.
No.
No,
No.
not for the whole 6 to 7 months.
Not for
The beginning, in the first in the
Okay.
beginning.
Only for the initial phase.
Okay, that's really too long. Okay, right here. So it's all on the textbook. Thank you for reading, John Louis.
People are considered non-infections after 2 to 3 weeks of continuous medication therapy.
Okay, so do we isolate them for 6 to 7 months?
No, we isolate them for 2 to 3 weeks.
Okay, 2 weeks minimum. It has to be continuous medication therapy. And of course, do we expect some improvement in the symptoms here during this period?
Yes.
Yes.
Of course, yeah, there should be improvement of symptoms. If, let's say, after 2 to 3 weeks, the symptoms are still there, the weight loss, the low-grade fever, the coughing nonstop, the purulent sputum, now what? Is the treatment working?
No.
No. Okay. Which is rare, though. Most people respond to this type of treatment. If they don't respond, that means we're dealing with a multi-drug resistant strain. So the patient may require different therapy. Okay, but most people will respond to these 4 drugs. So how long do we isolate them?
2 weeks
For
minimum,
3
3
weeks.
weeks maximum.
3 weeks of after continuous medication therapy and with improvement of symptoms. What do
Professor.
we do about the family members though? Because do we have a negative pressure room at your house?
No,
No.
So what do we do with the
Okay.
family members?
They can still wear a mask.
Put them
Alright.
in an Airbnb?
no,
What do we?
have them wear a mask.
Well, what were they doing before the patient was diagnosed with TB?
Not wearing a mask.
Right. So therefore, most likely what happened to the family members?
They still don't wear.
So
They
They
become.
have to
They
get tested.
They
become.
were already exposed.
Exposed.
So
Exposed.
therefore, what do we do about the family members?
We test them.
Do we test them?
Correct. So
Them
we
to be tested.
simply test them. And if any of them test positive, we'll do the same testing, X-ray and then sputum if symptomatic, and then we do the same treatment. Are we?
First question.
Yes.
So I know you said if the medication isn't working for the patient, the initial, that usually works for everybody. If it's not working for them, does that mean they have to be isolated even longer?
Well, we test first and then we try another set of antibiotics.
Okay, and during that set of antibiotics, they are isolated again. It's
Same,
basically
yeah, same thing. 2 weeks. All right, any questions?
No.
Alrighty. As far as the treatment with COPD, TB, which was not mentioned earlier, right? Because of the other, just how it's laid out in the chapter. Now, if you think about it, both are respiratory conditions, correct? So do we still give oxygen to patients with TB if they need it?
yes,
Do we give them bronchodilators if they need it?
yes,
Yes.
All right, so same thing. Do we increase fluids to liquefy the secretions?
yes,
Yes, you would.
Right. Do we promote nutrition?
Yes.
yes.
Same thing. Right. So it's not any different. So this applies to COPD as well, because they're both having shortness of breath, right?
Yes.
Right. And then of course infection prevention, especially in the hospital. All right, that's it, children.